Welcome back to my channel, and thank you for joining me again. Now today we are going to discuss a topic that's been requested by my students. So this might not be the topic for everyone. This is specifically for my students. Now, one of the things my students struggle with is how to choose an essay title. And if anyone who's ever written an essay that the title isn't given, you know that it's sometimes quite difficult to choose a title you're interested in. So, we can think of it as the freedom to choose a title, as any academic is not the easiest thing in the world. It can be quite difficult. And this is especially true, I think, when you're writing nursing essays, because nursing essays, they do contain a lot of scenario-based essays, and so sometimes it's difficult to choose a scenario. So although we might complain that an essay or an assignment topic might not be the one you like, that's been pre-given, when it's time to choose your own title, you do struggle. It's much harder choosing your own title than it is being given a title. So it's all about trying to choose a topic, something that you're not going to struggle to write about, something that you're interested in, something that you've always wondered about, a topic that will also fit into your word count. So what you're not going to do is to choose a really broad topic that will not fit into your word count. So today we are going to discuss case study. So the case study essay is the most common type of essay written in nursing and also in the social sciences as well. Two types of case study then. There is a case study method of analysis and a specific research design that is examining a problem or across any given population. A case study research paper examines a person, place, event, phenomena, or any type of subject of analysis that you need to extrapolate a theme and then discuss the result, and with the aim of helping to predict future trends, illuminate previously hidden issues, and that you can apply to your clinical practice. It's about providing a means of understanding important research problems, and giving it greater clarity. So it's about, a case study analysis is about finding the research problem and clarifying it. And this sorts of case studies usually addressed in a dissertation, but the case study that we are talking about is for shorter essays, maybe your 2,000, 3,000 word essay. So we're not talking about a dissertation that might be 10,000 or 20,000 words. We need to extrapolate and illuminate, but on a smaller basis, yes, and a minimal basis. So whilst a case study paper can also be designed as a comparative investigation that shows the relationship between two or more subjects, it can also be thought of as an explanatory essay. So you're explaining something, and it can also be a descriptive essay. So if you think about the case study essay, you're thinking really of an essay that explains or an essay that describes. So let's talk about an essay that explains a phenomenon. So you're probably a student nurse, you've been on the wards, or in COVID times, maybe not, but it's about choosing a title that you can explain within that word count. So in an explanatory essay, you're showing why and how something should be done. So you might discuss something like bed making, and you discuss why and how it should be done. You could discuss something more intrinsic like the medication round, and you can discuss why and how it should be done. And when you're choosing a topic for this type of essay, there's three specific steps that I think, as an educator, that students should really incorporate. So I think they should choose a topic that they understand, be specific, and gather their information. So in terms of choosing a topic you'll understand, it's that you will need to understand the process and the concept and understand the topic enough to be able to explain it in the essay from beginning to end. You need to understand whatever disease process it is, and because you're going to need to go in depth and explain it, if you don't understand this, then the lecturer that is reading your essay will find it lacking as you don't understand what you're writing about. So do choose a topic that you know about and a topic that you understand. And step 2, be specific. You could choose a topic like diabetes or hypertension, but that is a huge topic. Diabetes in itself is a huge topic. Hypertension is a huge topic. So you wouldn't choose a topic that is so wide. What you would do is choose a small, discrete topic. And what that means, small and discrete, is, okay, you like the idea of talking about diabetes, but what you would do is talk about type 2 diabetes instead of diabetes on a whole. So that makes the process smaller, and that can fit into a 3,000-word paper. Okay, let's think about hypertension. Hypertension is a vast area as well. And so you might say, for your essay title, you might discuss something like hypertension in the over 60s. That is making the research sample smaller, more intrinsic, and easier to discuss. But also, not only is it easy enough to discuss, it will be quite interesting because right away you've grabbed the attention of the reader. It's saying we're going to discuss type 2 diabetes, not type 1 or not 2.5 or 3, type 2 diabetes. Or we are going to discuss hypertension, not in Black and ethnic minorities, not in diabetics, not in the younger population, but in the over 60s. So that's how you choose your title. Right away, it grabs the attention of the reader, and the reader has set their mind to what they're expecting to see in your paper. And the final step for an explanatory essay is to gather your information. Now, this is a very, very important step. If you do not gather your information, you cannot write an essay. Make sure you have concrete details that support the information in your essay. You need to make sure you're including quotations, references, and statistics. Without those 3 things, quotation, references, and statistics, you cannot make points in your essay. So any points you make in your essay need to be backed up by other, more experienced researchers, and you will do that via quotes, references, and statistics. In terms of talking about quotes, references, and statistics, what we don't expect to see is a quotation from NHS Choices, because NHS Choices is geared towards patients and not clinicians. And so you'll find that the language on NHS Choices is not a clinician's language. But when you're writing your academic piece should contain clinician's language. And an example of that is you will not say high blood pressure in your essay, you will say hypertension. You will not say high cholesterol, you will say hyperlipidemia. So that's clinical language, and your essay should contain clinical language. Okay, let's move on. We're going to move on from an explanatory essay, and we're going to talk about a narrative or descriptive essay. A lot of nurses write these sort of essays as well. So in a narrative essay, the goal is to tell a story. And this is your essay that you choose a scenario. So you might choose a scenario often of a patient that you've worked with, of an MDT meeting you sat in with, of maybe a patient that you came across in a brief spell. It doesn't matter. You have to choose a scenario. What we love in nursing is when you choose a scenario that you've been a part of and you've engrossed yourself in the middle of this scenario, and you can talk about it in a really descriptive and narrative way. Okay, so these essays are the reader feel like they are in the scenario with the learner. So in a particular place or time, so you might say something like, I met patient A in a respiratory ward, and I offered this care. So that is setting up the scenario and setting the scene for the reader. When you choose a subject for this essay, there's 3 steps you should do. So you've chosen patient A. Now there's 3 things I think you should do. one, pick a transformative event. So choose an event. Choose an event that contains the things that you want to talk about. Don't choose an event regarding something that you're not interested in. Always choose an event that happens that you're interested in, and include a description of that event. So it's important that you describe the event. In a narrative essay, you need to choose an event where you make a change. Or it might not be you that made the change. It might be the nursing team that made the change, or it might be the physios that make the change. But just choose a situation or scenario that some sort of change was done. Maybe it's how you offer things like patient-centered or person-centered care to bed 5, or the role of the nurse in treating the stroke patient. So you're engrossing yourself in the care. You're talking about how nursing care is done with the stroke patient, or you're talking about how you offered patient-centered care to this patient, or person-centered care to this patient. You need to be able to show your growth in the scenario. For instance, when I just met patient A, I thought I wouldn't be able to give an injection, but at the end of the scenario, I learned how to give an injection, and I was more comfortable to do so. So that is showing that you've grown. So do highlight the nursing process and the benefits of the nursing process and how you've grown within the nursing process. Okay, step 2, choose an event that is contained. What you don't want to do is choose a scenario that there's so much going on that you lose your way in your essay. Instead of writing about an ongoing scenario, you should write about a scenario that already has an outcome. That way you have an outcome to conclude your essay. So you're going to write about a quintessential moment that's happened and something that you can close based on your experience in that scenario. For example, you might choose a scenario that you've been a part of. So you might say, I'm going to discuss bed 5 from admissions to discharge. So that is choosing a quintessential moment in the care of that person. So you discuss from admissions to discharge of that person if you're talking about something like patient-centered care. Your narrative should be within the word count. Please remember, always within the word count. There's a 10% under or a 10% over, so don't go outside of those. So pick an event that can be fully explained in that amount of words. So don't choose a patient from admission to discharge who's been on the ward for a year. A patient who's been on the ward for 6 months. You will not be able to discuss that scenario in a 2,000, 3,000 word essay. So just be careful of how you're choosing your scenarios. So in terms of step 3, include dialogue and description. Not dialogue so much, but a description. You can choose from many experiences, but try to pick one that includes other clinicians. It's really good when you're talking about the nursing process and patient-centered care that you equate this to the MDT, the multidisciplinary team. You must include other clinicians. Remember, nurses are not the only clinicians that look after patients. Other clinicians do as well. So include their role. You might not expand on it, but you must discuss it. Another thing that you should include in patient-centered care is the patient's relatives. Patients will often come in with their children. How do the children feel? And what impact is this disease having on the family? Can they cope? Do you need to include social services? So those are the kind of stuff that you will include in your essay when you're talking about dialogue and description. So I hope that helps you to choose a topic for your essay. So now that you've chosen a topic, one that you're interested in, if you're me, I would definitely choose asthma and COPD because obviously I love talking about asthma and COPD. So you've chosen your topic. What else is needed? Well, it's important to structure your essay. You need an essay that flows and reads well, one that the reader will be gripped and will be able to tick all the boxes to say that this is a really good essay. So our next video we'll highlight how to structure an essay. So when we talk about structure in the essay, we will also talk about how to critically analyze the essay. So thank you for watching, and I will see you on my next video.